So much for being with us this morning and just giving us time for your Saturday. And will y'all please help me welcome Dr. Wildenthal.
So first, let me say I'm glad to be here. I was going to be here anyway, sort of observing, because I'm like some of you, new to this organization. I just heard in June. Although I've been very aware of children for my whole career, because UT Southwestern Medical Center and Children's are just like this in terms of their cooperation, providing medical care to children. I would say from my perspective, both for the old-timers and the newcomers, and I count myself in the newcomers, your organization has three important tasks. The third, and least important, but still important, is have fun, enjoy this year of doing stuff together. The second very important thing is raise money. Raise money for Children's Medical Center, and I'll come back in a minute to why that's important. Even more important, if possible, than that is inspire your friends and classmates to want to give back, and your example will be tremendous in providing that inspiration. You know, the government can't do everything. Some people need help, and to make up that gap, and the gap is pretty darn big, you have to have people who can giving back to help those who can't. And by your presence here, you obviously want to help give back, and you've been privileged enough that you have the time and the capacity and the connections and the leadership skills, not only to give back to yourself, but to give back, help others learn how to give back. And you'll be amazed at the ripple effects of what you can do. You'll raise some money, that'll be great, but beyond that, next year and the year after, and more people and more people and more people will learn the joys of giving back. I'll give you just a small example. It's very personal for me. Excuse me, a little morning Coke. My granddaughter, her name was Catherine Kearney, was at Highland Park until 2 years ago when the family moved to New York. She was very much looking forward to earning the privilege of being part of this group, but she was too young at the time. But she knew from her with the upperclassmen what was going on, and she thought it was great. She moved to New York, and her school in Westchester County, which is just north of Manhattan, didn't have any kind of thing like this. And so she started to organize with some of her friends some sort of fundraiser that would help some good cause. They didn't happen to have a pediatric hospital in that little smallish town, but some sort of fundraiser, and it was, what they chose together was a schools program to help children with developmental disorders have special opportunities to recreational opportunities and educational opportunities. And now, how do you raise money in New York? Well, some of the things you can do, you can't do in Dallas. New York is cold, and so she and her friends organized a fundraiser in which they got sponsors to give a certain amount of money if they would jump into the ocean on February the 2nd. And it was fun, and it raised over $3,000, and about 75 kids learned that it's possible, with not a whole lot of effort and a lot of joy, to do something that's good for others. So whatever you do is going to be important. How much ever money you make is going to be important, but inspiring others to follow your example is, in my mind, even more important. Now, why is it important to raise money? For Children's Hospital specifically, there's lots of worthy causes. I happen to think Children's is one of the most worthy. You obviously do too, or you wouldn't be here. Why is that important at Children's Medical Center? Here's a fact that staggers some people. In the entire United States, for every $6 that is spent on everything, from defense to chewing gum, one of those $6 is spent on something having to do with healthcare. A tremendous part of what the American public spends is on health care. It's a very expensive proposition. Now, if you then isolate that and say, well, is it expensive to receive medical care? The answer is, if you're well off and have insurance, it's usually not that expensive. It's not 1/6 of your entire income, unless you have some catastrophic illness. And very few kids have catastrophic illnesses, thank goodness. But those who do, that's a real crisis. But 25% of kids in Dallas don't have any insurance. And really their parents don't have, for the vast majority of those, their parents really just can't afford it. When you think about how much does an insurance policy cost and all of the deductibles and co-pays and everything, which you don't have to worry about yet, but your parents are, I can promise you. If you're making $200,000 a year, you can afford it. If you're making $35,000 a year, that's an enormous fraction of your income. And so a lot of children do not have health insurance, even if they're covered by Medicaid, which is the federal and state program that provides insurance for the poorest of the poor. It doesn't cover all the costs. What do they do? Well, the answer in Dallas is simple. They come to Children's Medical Center, either to our emergency room for admission to the hospital or treatment and not admission. Or increasingly, we have clinics called My Children's Clinics spotted throughout the community, so that they don't have to come and wait in the emergency room for a couple of hours for something that does not require hospitalization, but they can actually, just like you do, go to a pediatrician's office and get routine care. Those things cost money. Now, Children's Medical Center is a non-profit organization. That means we don't pay taxes, and every dollar that we make goes back into investments for expansion and more services. But when you think about nonprofits, and there's an enormous number of nonprofits out in the world that you'll spend your life, I hope, raising money for, and you'll choose the ones that you think are the most valuable and most important, and it's all the way from educational institutions, arts institutions, to health, to mental health, social services, taking care of battered children or battered spouses and so forth. But nonprofit does not mean that you operate every year at a loss. If you operated every year at a loss because you're a nonprofit, guess what? You go out of business. You can't pay your bills. So something has to exist to make up the difference between the very large cost of providing medical care, in children's case, to every child who walks through the door, any of our doors, whether it's the emergency room door, whether it's being brought in an ambulance, whether you need the care or not, or you're just scared to think you do, doesn't matter. Whether it's out at My Children's Clinic for a vaccination, every child gets the treatment they need, irrespective of their ability to pay, irrespective of whether they have insurance. How do you make up that gap if you're a nonprofit? You don't just say, well, too bad, I can't pay my bills. Go broke. The gap is made out through philanthropy, through people who write a check or who produce events that inspire others to write a check. That's you. Now, at this point in your life, the amount of money you raise is going to be a big help, but it's not going to be the literally millions, tens of millions of dollars that we need. But that's why I say the money you raise is important. Every dime matters, every dollar matters, every $100 matters. And we want you to raise as much as you can, but even more important than that is to get in the habit, which you wouldn't be spending Saturday morning here, but persuade other people to get in the habit of realizing that our society thrives on volunteers working and paying. And you can be the leaders that make that tradition of American philanthropy pass on from your grandparents and your parents to your peers and yourself, and ultimately your children. So what you're doing is very important. It's important because we hope you have fun doing it. It's important because you're going to raise some significant money. And it's especially important because you're going to inspire a whole generation of your colleagues to understand the importance of philanthropy and understand the importance of children's medical care. So you're going to get a tour this morning. You're going to see a very large organization. You're only going to see a tiny fraction of it. Underneath that are thousands of people who are working to keep things clean, to make sure that the equipment works, to make sure that the computers provide the information that the doctors and nurses need, to buy the equipment and all that stuff. As well as outreach clinics that you won't see today, but which are also important in preventing bad illnesses by catching them early, giving vaccinations, making sure if you've got asthma, for example, you get the care you need to control the asthma, so that rather than, which is the way you should treat asthma, the way if any of you have asthma you're treated is you go to the doctor regularly and you have the kind of medication you need to prevent an asthma attack. A lot of kids with no regular health care, what happens is they wait until their death's over, literally, and the ambulance brings them in, and some of them die with asthma that could have been prevented if they'd had early care. Or if they don't die, they spend several days in the hospital because they're emergency ill because they didn't get the proper kind of care. So everything that you do is going to be geared toward helping Children's Medical Center be sure that it never turns away a single child who needs medical care at whatever level, at any place throughout our community. You ought to be very proud that you're willing to give up a Saturday morning to do that. I hope you have fun doing it as well. I'll just tell you a little more about myself and children's. When I came to medical school out of a little college in West Texas where I'd grown up, I thought this medical complex here, which was UT Southwestern Medical Center, training people to be doctors and healthcare professionals and doing medical research and providing the physicians that care for the patients that come to Parkland, Zaylogy Hospital, St. Paul Hospital, and Children's Medical Center. And Parkland itself and Children's were just wonderful and staying. Well, when I came here, there were 4 buildings. Now, if you added up all those buildings, they're probably 70 or 80 or something like that. But the buildings are not what are important. What's important is all the activities that are going on. I went from here to New York City to Bellevue Hospital, which is a world-famous hospital that sort of was the inspiration for TV shows on emergency rooms and all that. What did I find? I found that Bellevue Hospital was a wonderful hospital. This medical complex here was better. The quality of care that I had learned in medical school here, Children's Hospital and Parkland Hospital, the other hospitals in town, was actually better than the world-famous Bellevue Hospital. I was better prepared than the other interns in my class who came from Harvard and Johns Hopkins and all the other famous old 200-year-old schools. We have in Dallas a caliber of medical care at Children's and also at Parkland and Zaylogy and St. Paul and Baylor and Presbyterian and Methodist and Medical City. A quality of medical care that's just exceptional. You'll be very proud of your community. But we need to make sure that everybody in the community has access to that standard of care, and that's what Children's mission is. It's to make life better for children, and especially to do that by making sure they have the medical care they need, preventative and emergency. And I hope we never see any of your family here because your life's in danger. But if it is, you'll be very glad this institution exists. So I'm just thrilled that people like you, and like I'm a proud grandfather like my grandmother, are willing to get out there and inspire others with the tradition of philanthropy and help a local institution like this. I'd be happy to answer any questions, and thank you for having me here. And again, Mr. Durovich is very sorry that he's not here.